together with Tan Sri Dr. Jamila Mahmud, Health Advisor to the Prime Minister of Malaysia, and Professor Dr. Adiba Kamrul Zaman, Infectious Diseases Specialist and WHO Science Council member. As always, our session today is made possible by Pusat Perubatan Naluri and brought to you by Satellite TV by Astro Wani. Today we'll be discussing long COVID and the implications of this condition. Long COVID is the recovery or non-recovery, sometimes of months from a COVID-19 infection. Dr. Jim, I heard the term long COVID first from you a couple of months ago, and I was struck by how you described it to me. Would you please share your explanation with our viewers today?
Thanks so much, Karen. Assalamualaikum and good afternoon, everyone. It's good to be back. I'm really glad there are two real COVID experts here to talk to us about it. And welcome, Dr. Yasmin. Lovely to have you with us today. Long COVID, simply put, is that, once you have an infection with COVID, you think you've got over it, but actually there are long-term consequences. Just this morning, for example, I heard news from one of my friends that he lost a relative who had come out of the wards, went home, but had long-term complications in her lung. And as a result, eventually couldn't maintain her oxygenation and succumbed. So it's about having these long-term complications that range from just perpetual lethargy and pain and body aches, having a bit of a brain fog, and then the more serious stuff, right? The cardiac, the pulmonary, and other complications. So I'm glad that we're discussing this today because many people don't realize it's not just about catching COVID, but also the other long-term consequences of it.
All right. Professor Adiba, as an expert in infectious diseases, can you walk us through why COVID-19, because of its debilitating long COVID phase, is so much more threatening than other infectious diseases?
Thanks, Karen. Good afternoon, everyone. And yes, thanks, Yasmin, for joining us. I know you've had a rough 18 months as being one of the lead ID clinicians at Hospital Sungai Buloh. So thank you very much for making time to be with us this Sunday. Actually, Karen, there is still a lot that we don't know about this long COVID, or the Americans call it the Post Acute Covid Syndrome. Initially it was thought to affect, only those who had severe disease, but now it's becoming quite clear that even people without severe disease can develop this long COVID. So, there's intense research going on. Is it a direct viral effect? Is it an immune system effect of that's causing all these problems? So there's much we don't know and much that needs to be learned and researched. So what we do know is that, like I said, it can affect both people who had mild disease as well as people who had severe disease. In the UK, they've divided it into what we call the acute phase, so up to 4 weeks after developing the disease. And then if you continue to have symptoms, up to 12 weeks, and then the real post-COVID are, 3 months or longer after that. So there are groups, and including here in Malaysia, that are following patients up very carefully to see, how it eventually all pans out. I dare say we're probably going to see differences, I think, or we may not. Maybe the cohort that's being followed up in the UK and US is in terms of how frequently it happens, etc., may be totally different from Malaysia. So it's critical that we also follow up our patients ourselves and learn as we go along.
Right, like you mentioned before, Professor and Dr. Jamila, one of our guests today, Dr. Yasmin Muhammad Ghani, also an infectious diseases physician like Professor Adiba, has been in the thick of things, based at the Sungai Buloh Hospital, the epicenter of COVID care from the onset of the pandemic until now. So welcome, Dr. Yasmin. Thank you for spending this evening with us. And can you tell our viewers something of the awesome work you and your colleagues at...
Thank you for organizers for having me, as well as Prof and Tan Sri for inviting me for this session. It is, I suppose, life changed for us. Life changed for all of us in Sungai Buloh, that we were getting a few imported cases coming in. And when we thought we've got things under control, we got a bit of a breather. But since I would say November, December, we've been battling it, and I think probably still seeing the peak of things at the moment. So in Sungai Buloh, as you all know, is one of the designated centers now for COVID-19. Due to the sheer number of cases, the government has actually been forced to open another hospital, and I only share the pain of decanting a hospital for pure. It's not just, but a hugely motivated team of consultants, physicians, and general physicians. Even they don't necessarily come from an internal medicine background, but the entire hospital came together, including our hospital director came together to sort of transform the entire hospital into a free-flowing discharge and admissions of COVID, and our ICU colleagues as well. So we work together. So my role is more not COVID cases, but as well as we play a huge management role in managing these admissions and discharges, and following up patients as an outpatient services shortly after they actually discharge. So that's how life has been for most of us in Sungai Buloh.
That sounds very, very long haul, and it sounds very, very painful. And on behalf of everybody who knows how hard you and your teams have been working, we thank you. So how long after the start of the COVID pandemic was long COVID diagnosed, Dr. Yasmin? And may I ask if long COVID is treated as a separate illness from a COVID-19 infection?
I suppose long COVID started off a patient term. I think it started off as a Twitter. I was just sort of looking through the history of long COVID. Apparently, it started off in the US as a tweet from an ex-patient, and soon after, NIH and the NICE guidelines have started recognizing long COVID as a spectrum of COVID infections. This is not just seen, I suppose, in COVID. We do see it in some of the other viral illnesses. We do see long-term complications of viral illnesses, but soon after, guidelines sort of put it in perspective, and we sort of know that long COVID symptoms is sort of like a spectrum that you see from an acute illness, and then it's more of a time-related spectrum diagnosis of disease. That sort of has earned its place in COVID history, and as Prof. Adiba pointed out, it's also called as post acute sequelae of SARS-CoV-2 infections, and generally it gets its term by about 12 weeks, I suppose, after the first initial insult of COVID infection. And recently, I think MOH has also released a guideline of COVID-19 management and protocol. I suppose that will also give physicians a little bit of insight into.
All right. So can you explain to the audience what defines long COVID, Dr. Yasmin? Is there just one set of fixed symptoms, or do they differ person to person?
I really think it differs from person to person. There have been some hypotheses which is going on exactly why long COVID happens. It could be due to it could be due to ongoing inflammation, or due to direct effects of the virus, but that the patient has due to as a result of COVID-19 infections. it's generally a spectrum of insults that patients. So the more severe, like Prof said, it's not just a severe illness who actually get post long COVID symptoms, but those with mild illnesses also sort of COVID symptoms. So in my hospital, there's a team, a rehabilitation team that sort of follows up these patients, and they have the database of more than 2,000. They recognized about 65% of them actually present with symptoms. So you kind of get a mixture of neurological symptoms. You can get someone with loss of concentration, like a fog-like expression, and anxiety, depression, respiratory, ongoing cough, exertional shortness of breath, chest tightness, and difficulty in sleeping. These are some of the symptoms that are routinely exhibited by somebody who actually has long COVID-19. And it probably varies from one person and the other person. It's difficult for me to actually say whether it's a totally different entity whatsoever. I don't think we know enough about long COVID-19 in order to call it as a different entity. But I suppose anyone who's recovering from an acute illness, especially if they had it bad, like due to a post-ICU, so probably will have more longer lingering symptoms. Whether this is a totally different entity or not, I suppose more studies are actually needed before we make that inference.
Okay. Just to give us a ballpark figure to things, would you have an idea, Dr. Yasmin, as to how many long COVID sufferers there are in Malaysia, or how many you yourself have seen or treated?
Right. So we sort of optimize every resources that we have. Most of our COVID patients are actually followed up very short.
Is Yasmin having connection?
We follow them up for any medical related. Sorry.
Yeah, sorry, Dr. Yasmin, your connection has just gotten very bad for a while.
Is it difficult to hear me?
Yes, I think it's your connection. Would you like to try logging out and coming back again?
Okay.
Okay. Well, wait.
Okay, I can do that.
Yep.
All right. Okay.
All right, so meanwhile, I've read some very jarring incidences in the UK about some well-known personalities committing suicide because they could not deal with the symptoms of long COVID, right? Professor Adiba, this is, I guess this is very like in your face, a very in your face question, but you know, how bad can the symptoms be, and do the patients that you treat at PPUM and when they're followed up on, do they complain of such horrible, you know, long effects of COVID that they feel that, you know, I've come to the end of my rope?
Well, fortunately, no. And, you know, but we, unlike Sungai Buloh, have not had as many patients. But even then, I think we have established, similarly, we have established a team and a cohort to see all of our patients, even with mild symptoms, just to follow them up. For now, it would appear that those with severe symptoms, ongoing severe symptoms of fatigue and you know, and difficulty breathing, it's related to how severe their illness was in the first place. So that kind of makes sense, doesn't it? Especially those who have had a lot of lung damage. But even those who recovered from the lung damage may also end up with a lot of tiredness and fatigue. And I think that's what many people are claiming. We haven't followed people long enough, nor have had a big enough cohort to be able to say that those with mild symptoms have like what the Americans and the UK are describing, and what Yasmin is describing. But to that severe sort of debilitating disease that you've just described, fortunately not, unless they've also had very severe disease and was in ICU for a long time and needed ventilation. yeah, that's
Okay, I give a little bit of a segue into another of your pet specialities. When you speak about dengue and you talk about dengue as being one of our scourges in Malaysia, would you see any kind of similarities in the post effects of dengue long term and post effects of COVID?
Yeah, so like Yasmin alluded to before, post-viral chronic fatigue syndrome is an entity. I must admit, when I was training in infectious disease, I used to think that this was, possibly psychological. But I think it's real. And it's more seen rather than dengue. It's probably more common in someone with Epstein-Barr virus, or commonly known as glandular fever. That post-fatigue is very well described in glandular fever, less so in dengue, but now we're seeing in COVID-19. So, post-viral fatigue, post-viral illness happens, but it would appear that in COVID, it's much more pronounced than other infections.
Okay. Thank you, Professor. Dr. Yasmin, so coming back to what you were saying before we were interrupted and you have to come back in, give us an idea of how many long COVID sufferers there might be in Malaysia, and is this a thing? Like, is it safe to say that nearly everybody who has had COVID before will suffer from long COVID?
It's I hope my connection's a bit more stable now. Sorry about that.
Yes.
So like I was saying, we follow up our rehabilitation team. Our rehab team actually actively follows up patients. They call themselves CROSS, which is COVID rehabilitation outpatient specialized services. And they sort of have a 2,000 plus patient database. And from them, they are able to deduce about 65 to 70% of patients actually were suffering from long COVID. And some of the symptoms that are quite common are like fatigue, and up to 80% of the patients, 51% of them talk about difficulty breathing. 16% of them actually have difficulty sleeping, and a few other percentage complaining of persistent lung damage, persistent cough, difficulty in moving around, musculoskeletal weakness. So I would say that, yes, it does affect a large percentage of people. It probably varies from one person to the other.
Is there enough data to say that, okay, this is the most common symptoms of long COVID, and these are the slightly more out of left field ones?
Of course, because we are still collecting data, but from what experience that has been shared by the rehab, and also those short-term follow-up patients that we actually see in our COVID clinic, fatigue and respiratory symptoms, just persistent cough and exertional shortness of breath, seems to be one of the most common complaints that people talk about when it comes to long COVID.
So we are not going to assume that all people with long COVID will suffer from the same symptoms. So it's very highly likely, because it's so new to all of us, that somebody might come in who's suffered from COVID and present something that is not on the radar currently of long COVID symptoms, right? And then when traced back, there is a possibility of it actually being a stranger side effect to a COVID infection. Would that be possible, Dr. Yasmin?
I suppose so, we can say that, but just like anybody who's discharged from a hospital who has persistent symptoms, the first thing a clinician always does is make sure that they don't have persistent, ongoing insults that can actually make them more sicker. And so if you have no other plausible explanation to their symptoms, blaming it on long COVID is something that we tend to do, especially if the symptoms seem to go on, but the patients continue to sort of somewhat improve. And this is what we're saying. Like I said, it's fairly new disease, and it's a very limited database that we actually have. And establishing a database requires a lot of work and manpower, and they are doing it quite well. And based on their limited experience and ongoing moving target that they're actually doing in the hospitals, I suppose these are some of the common symptoms that we do see. But of course, at every follow-up, because the treatment of COVID itself involves quite a bit of immunosuppression sometimes. So we as doctors and clinicians, we do look out for some other complications that are related to admissions, I suppose. And once we rule that out and make sure that the patient's safe, and yeah, some of the symptoms, we do blame it on long COVID, like fatigue and shortness of breath.
Okay, so one of the things that struck me about some of the long COVID symptoms, excuse me, is the continued lack of the ability to taste. I've heard about people who can no longer enjoy coffee because the way that coffee tastes has changed horribly. And there's stories of sommeliers who've been put out of jobs because they can no longer scent their vintages. So why does COVID-19 affect taste so badly? And would you have an idea of how long it would be until a person with long COVID regains that sense of taste?
Right. I don't think we know the exact pathophysiology behind it, exact reason behind it. We don't really know.
Yasmin's having problems. So let me answer that. It's because
Oh dear. All right. I wonder if it's raining where Prof. Adiba is. Okay.
Can you hear me now?
Yeah, I can hear you, Yasmin. Yes.
Okay. Okay. So we're not very sure exactly why it happens, but it could be due to a viral inflammation or inflammatory reaction that actually happens in the nasal cell, and it sort of supports. It sort of affects possibly some of the support cells that helps us in smell and taste. A recent Harvard study actually says that this is something which is irreversible, and how long? I suppose there are some reports that says that it can actually go up to 6 months. But in CROSS, they looked at patients at about 3 months and 6 month interval, and they saw about 1.4% of them actually had persistent anosmia and agousia, difficulty to smell and taste, and that were persistent. But it's probably more. It's less. It's rare, but it's definitely there. But it's seen in a very small minority of people. Persistent symptoms, about 1.4% in that 740 people that they studied. So you can sort of extrapolate.
Okay.
You don't really say
something before you rejoined. You're muted.
I was that's I was going to say exactly what Yasmin said. Yeah.
Okay, cool. Okay, Adiba, this question's for you. The World Health Organization's Director General, Tedros Adhanom, has warned about the impact long COVID has on the individual, on society, on the economy. And he's highlighted the importance of the 3 R's: recognition, research, and rehabilitation. Are you able to speak more on this on a Malaysian perspective?
Yeah, I think Yasmin has touched on that. It's really important that we recognize and we research and we rehabilitate, right? So both our hospitals have established this multidisciplinary team to support patients who have been discharged from hospital and also to study it. As Sungabulo is, we are too, and also not just at the symptom clinical level, but also understanding the biological basis for this, so the immune response, etc., etc. So I can't agree more, because yes, the quality of life of our patients may be affected. Returning to work may be affected, and then all these physical symptoms may compound mental health as well, especially there's so much going on, around us at the moment, people losing jobs, etc., etc. So all this will add up, and it can, add serious amount of stress to an already stressed system. And to the individual, obviously. So yes, we need to take this seriously, and only by understanding it both in terms of at the molecular level, as well as the clinical level, as well as at the mental health and the mental health impact it can potentially have. Can we then intervene, provide support, provide treatment, etc., etc.
All right.
What's important is to have a team. I think we both hospitals have approached it from a team effort. At our place, our team consists also of rehab specialists, chest physicians, counselors, and what have you. Yeah.
All right. Prof. And Dr. Yasmin, WHO, the CDC, they share about the hidden iceberg of undiagnosed COVID-19 people who are now suffering from long COVID, but because they did not know they had COVID in the first place, and that could be like 10-20% of all COVID-19 infections. So we're seeing a possibility of 10 to 20 million long-term cases to manage in the long run worldwide. Is that something that we should be worried about in Malaysia?
I go first.
Yeah, unfortunately, Yasmin's connection is very bad. If I can jump in to assist there, I think, Karen, yeah, I mean, it looks like what is an acute illness, i.e. COVID, is going to may in some people turn into a long illness. And I guess this is, I suppose, no different from something like HIV, which is a chronic disease. It used to be a fatal disease, but if treated well, it can turn into a long, manageable condition. And I guess you can look at long COVID in a similar manner, minus, I suppose, the intense stigma that people living with HIV suffer from. So how this would impact on the health system remains to be seen. It would also depend on the severity. Obviously, the more support you need, whether physical support or mental health support, the more it's going to require of the health system. So yes, it could certainly have a big impact on the health system.
All right.
On the acute phase.
Okay. Dr. Jim, how does our healthcare system plan to handle long COVID? What really can be done from a wide organizational health point of view?
I think that's a question best answered by Yasmin. What I maybe before you get her to answer that, I just want to reiterate one point that Adiba made about stigmatization, about living with the long-term possibility of COVID. And I think that, you have heard of late, even countries like Singapore and the UK and others talking about living with COVID, right? Accepting that it's going to be endemic. And I think at some point we will have to say the same thing. Which means that whatever we do now, I mean, right now we're in a bit of a crazy phase where we need to bring the numbers down. But I think that's how, we have to look at the longer term process as well. Now, in terms of the healthcare, it's a wake up call for our healthcare because, it has to put in place the preparedness, the measures, the investments in good public health to be able to cope with this because, this is not going to be the last pandemic. There's going to be more and more outbreaks of other zoonotic diseases and we can go on and on talking about that. But I think, I would love to hear, both Yasmin and Adiba on this matter because they're very much involved in the clinical side of things, which I'm not.
All right.
Yeah, if whilst Yasmin settles in again, I think, Karen, that's a really important question in terms of how will the health system adapt. Often when we talk about health system, we only think of doctors and nurses, yet the health system is much larger than that. So, if there are silver linings to COVID, and I know Tan Sri Jamila is working very, very hard on this, is that we need to think about a true health system transformation, which means that, community-based care needs to be emphasized. Task shifting down to community level nurses, allied health like physiotherapists and occupational therapists need to be upgraded, because it's no longer, in a way, it's, to help individuals and patients cope with symptoms of long COVID. Doctors can only do so much, but the other important members of the team are physiotherapists and occupational therapists and all these people who need to be, the whole specialty needs to be expanded, community-based care, same things that we need for the elderly care, care of the elderly, care of children with disabilities, etc. Move it away from hospitals and into the community, which requires this whole different kind of thinking around the health system. And I know Tan Sri is working on that.
All right. Dr. Yasmin, can you weigh in on this as well? How does our healthcare system plan to handle long COVID, and what really can be done from your point of view? Oh no. Oh my gosh. Adiba,
It must be raining. It must be raining in that area. Yeah, because it's,
I'm sorry, Yasmin, we've lost you again.
Yeah.
It's okay. Maybe try turning off your video so it doesn't buffer for so long, and just get you on audio.
And maybe just try using 4G, not Wi-Fi.
The wonderful perils of doing interviews on Zoom.
Yeah.
Can someone hear me now?
Yes, we
Yes.
can. Go for it.
Okay. I'm really, really sorry. So it has to be the weather. So like Prof said, I got into gist of what Tan Sri and Prof was saying. I think our healthcare system has dealt with chronic care as well as integrated care involving physiotherapy, pharmacists, doctors, nurses, for quite some time. We already have an integrated system which is already set up. So I know this is probably too early to say this, but I think when it comes to long COVID care, we will be able to absorb and attend to patients in this system, integrated system that's of referrals and support services that's already been set up. I don't see that, and I'm sure a lot of eminent people are already, like countries, already working on it. But it's more the overwhelming that the healthcare system is seeing now with the acute COVIDs, severe sickness is what is debilitating us. But I don't see long COVID will probably just in the future get absorbed into the integrated healthcare system that we already have.
Okay, so Dr. Yasmin, how are the long-term effects of COVID-19, which may include fatigue, respiratory symptoms, neurological symptoms, how are they going to be treated by doctors? Which specialists should a person with long COVID be treated by? And would a multidisciplinary panel of doctors be needed by one patient to manage long COVID symptoms?
I think all of us know by now, and like Prof sort of mentioned just now, it's a multidisciplinary system of doctors and integrated referrals that you actually need. Majority of these symptoms are very non-specific, but there are some symptoms that we do pay extra attention to, especially the respiratory symptoms. There are some long-term complications of COVID that we are slowly recognizing that could actually impact a person's healthcare system. Now, we don't even know whether COVID can actually also impact in a metabolic pathway. And just like sometimes HIV does, in long-term complications, it actually leads up to a lot of diabetes, hypertension, heart disease and stuff. But we already know COVID complications, even in the first 12 weeks or even in the long COVID symptoms, can be associated with some more serious side effects, like what we call as a stiffening of the lung or organizing pneumonia. These patients may actually need a more specialized care, like a respiratory physician who actually follows up, and they may need to be on long-term medications for these complications. But and if patients suffer from more what we call thrombotic events, where they actually get a heart attack or a stroke or something like that, they probably need a specialized team of doctors. But it's difficult to say. So it's case-to-case basis. It's per patient as he is. So that's probably what the future will look like for COVID with us. But at the moment, it's more of a rehabilitation medicine that seems to be playing quite a bit of role, because a lot of them actually do need a bit of pulmonary rehab when it comes to severe COVID.
If I may, Karen.
Yes, Doctor.
And pointed out by our two esteemed speakers before, that the long-term sequelae, if you like, of diseases like COVID or HIV is also a psychological pressure, right? And I think people often don't talk enough about, the real mental health issues that persist with COVID survivors. Because for one of the big problems is that there is still some degree of stigmatization. How did you get COVID? What were you weren't careful enough, that kind of thing. And a lot of guilt, especially if it's transmitted to vulnerable populations, and should they succumb or have long-term problems, right? But I think one thing that I hope our listeners will and viewers will take away is that you don't want to get COVID in the first place, because you can't get long COVID without COVID, right? And therefore all the precautions that need to be taken for you not to get COVID. But that if you do, then it is going to be a long haul. But people should be aware that they will need that continued support. And the fear, of course, is that you will get other longer term complications. We were talking, I think, the last episode about obesity and diabetes in the previous episodes as well, how it might even be affected by COVID.
Absolutely. So this actually means long COVID is going to impact on our health system as well, because more doctors will be pressed into seeing patients, because patients with long COVID will probably need the attention of more than one specialist. Is that correct, Dr. Yasmin?
Yeah, I suppose that's what we've been sort of implementing all along, that there will be an increased number of patients who actually need specialized care, whether as Tan Sri correctly identified mental health issues or metabolic issues or more of lung-related damage issues that actually crops up in their history of illness after they get discharged. Yeah, I don't think so this is something that we will be seeing.
Dr. Jamila, so is our present healthcare system ready for this kind of long haul care? When I began writing about affiliated health, when I began writing about allied health, people in the business and they didn't quite get it, and they're like, why do we need these people? No, they're not doctors per se. Why should we be leaving these outpatients into the care of allied practitioners? So what will COVID and long COVID change in things?
Okay, I think that's a really good question. Now, our health system has been a good health system, so to speak, in the last we have a decent health system, let's put it this way. But I think COVID has really exposed where there may be gaps, and it provides us an opportunity to improve. Now, I've been very lucky to have Adiba working with me on what she mentioned earlier about transforming the health system. And we've just completed phase 1, which means a really honest look at our health systems, what is it that needs to change, and from a COVID perspective as well, where are the gaps? And so, this hopefully will lead into a real shift and a blueprint into how we actually transform the entire health system. But as Adiba mentioned before, one of the challenges with our health system is the dichotomy between public and private. So, when you have a health system like that, then if you go to a GP, which is a primary provider for many people in Malaysia, there's a huge disconnect. Sometimes you get admitted to hospital, your GP has no idea what happened to you, and vice versa. So, if we are going to have a much more transformed health system, it's really about making sure that the system is integrated. Management of data has got to be, at topmost priority. But equally important is putting hand into people's health, which means that you cannot just be the role of the hospital or the doctors to take care of your health. You have to take care of your health, which means you have to look into all sorts of things. We are the most obese country, and we have also the very, very high incidence of non-communicable diseases, right? And this alone is not about medicalizing the treatment of these conditions. It's about lifestyle. It's about, understanding from an educational perspective about eating well. It's about training children to avoid junk food and fast food. It's about making policies to stop all this, 24-hour nasi lemak and all this, and there's so many things I can go on about it, smoking, and so on and so forth. So we have a lot to do, a long way to go. So if you have now, long COVID, and what Dr. Yasmin said, we need rehab physicians. We don't have many rehab physicians. It's a real gap. People become surgeons and whatever, but there's very few who become occupational health experts. Rehab experts, geriatricians. It's rare to find these specialties. So we need to start looking at investing in those.
So what happens now? Where does policy begin? Who is going to call the shots on this kind of stuff?
Well, let's see. I mean, we are now working on that health reform piece, and I hope that it will be at least a catalyst for us to look into that. But if we don't start reforming, we don't start putting in these measures, then the people are going to suffer, especially because if you talk in the context of COVID, there will be people with long COVID. So, we have to demand this of our health system to have that.
So in the meanwhile, I'm assuming that the only way not to be a burden to an already stressed healthcare system is to not catch COVID at all, correct?
And not just burden to health system, but it's also to you yourself.
Of course.
Right? The healthcare system will have to continually transform and improve. But, the best thing is not to catch the disease by, protecting yourself with vaccines, making sure that you comply with the SOPs, ventilation. We've been talking about this over and over and over again, making sure that, your house, your workplace, all that's well ventilated, and adjusting your lifestyle. Life cannot go back to normal.
That sounds so sad. Life cannot go back to normal. In a way, because we
sad. It's not sad, Karen, because normal wasn't good.
That's true. I was going to say that, that our normal was what we perceived as normal was actually very, very abnormal. We live a very, very strange life. In a lot of Asia, we take overwork as a sign of honor. We take long hours at the office as, a way to prove our worth. But yes, definitely, these are the things that I don't mind seeing change. All right, so moving along, may I ask if vaccination can help a person who has developed COVID-19 not to develop long-term COVID? Is there any kind of medical knowledge to this?
There have been some reports. I hope my connection's a bit more stable now.
Yep, it's good.
Okay, there have been some reports that COVID-19 vaccination does abate some of the symptoms. And but we don't really, and some reports of getting COVID-19 vaccination actually reduces the kind of illness that they actually get after if they do get infected, and it causes more mild symptoms. So in such a way, it may actually reduce the impact of long COVID symptoms. So there are some reports.
Oh, that sounds really, really good. But it's not correct to say that it's a given, right? That everyone who has COVID-19 will suffer from long COVID, right, Dr. Yasmin?
No.
Okay. And so how does a physician actually diagnose a person with long COVID? What makes a specialist say, okay, based on what you're presenting, we believe that you are suffering from long COVID?
Like I said before, some of the symptoms are very mild and they don't progress with time. So we do see them in our clinic to make sure that we haven't missed any serious complications from long COVID. And some of the symptoms sort of mirror the more what we call serious complications that we actually see in patients with long COVID. And obviously, anybody who gets admitted in a hospital, sometimes when they get discharged, they are at risk of getting another infection that they would have picked up from there. Not necessarily COVID-19, but there are a lot of other hospital-related complications that you can actually get, like pressure sores and bacterial infections and line-related infections that may that someone can be predisposed to. But so if you actually have some lingering symptoms, but you don't physically have any sort of complications, like if the x-rays are better, the blood test is better, patients actually look all right, you know, they're not, and we check them for any complications, and it comes back as clean slate. And the patients are safely beyond the 3-month mark, I suppose, then we start thinking that these patients actually do some of these symptoms may actually be due to long COVID, and respiratory symptoms and lethargy and tiredness is something that everybody complains about. Almost everyone actually complains about when it comes to, it could also be because the patients that we tend to see back are the patients who generally develop a lot of complications from COVID, who actually get needed oxygen in the hospital, and then they come back for a review to see whether they are better or not. So some of these symptoms, I suppose, the more severe illness you are more likely to get long COVID symptoms. But of course, we don't wait until the 3-month mark to actually make that diagnosis. So we start working up patients even as we see them, as often as frequent as sometimes 2-week ones or monthly, to see whether these patients are getting better or not. So when we see them long enough, you know, we sort of make that deduction, okay, there's probably nothing medically worrisome here, but some of these symptoms could be due to long COVID. And this is when our rehab team comes in and takes over from us, and majority of them actually do get better.
So this is probably asking too much to ask, but would you have an idea of how long the course of long COVID will drag out for, Dr. Yasmin?
Harvard University study says it could be up to 6 months. I think NICE guidelines mentioned that they've seen patients, Fossey mentioned, I think Professor Fossey mentioned some time ago that it could go on to about 9 months or so. We don't really know. But I'm sure it would take several months for these symptoms to get better. And by getting vaccinated, it's probably one surefire way to actually reduce those. And of course, and as Transri mentioned, adopting a better lifestyle, controlling all your comorbidities, your diabetes, your hypertension, being a more active lifestyle, getting enough sleep, eating healthy food, clean food, and doing regular breathing exercises is probably going to also help us control this symptom better.
Right. Not to be morbid, but can I ask if someone can die from long COVID?
Tansri, please go ahead.
No, you see it all the time. And I was going to say yes, because I just started saying I got news that a very dear person lost his aunt from long COVID.
Yeah. I suppose an undiagnosed long COVID could also be a prolonged complications from the COVID-19 infections. We have seen patients coming back for readmissions and getting more sicker due to a very badly damaged lung that predisposes them to lung infection. We've also seen patients coming in discharged and then coming in with heart disease, heart attacks, strokes, and of course the more, you know, if some people, not everybody has got that access and that motivation to actually go there and get themselves back up better. So some patients who are discharged very ill are predisposed to more skin and soft tissue infections where they get pressure sores. So I suppose it's not just long COVID that kills them, but a poor pre-morbid state, more severe illness like a post-ICU syndrome, and a poorer immune system, patients succumb to that.
Dr. Nazmin, you see COVID patients every day. Are there any long COVID patients who've had to return to the COVID ward, and or are they treated in wards for other subspecialties such as cardiac, respiratory, and the other problems?
I'm sure there are some patients who get admitted in another hospital. Like I said, we do see some patients back, but not as long as long COVID. So long COVID definition by right, it's supposed to be after 12 weeks or so. But we do see patients within that time period of acute COVID and persistent COVID symptoms where they come in with complications. Like I said before, we have lost 1 or 2 patients like that, and we do have some admissions related more to heart disease, related more to a poor comorbid state that they come in with. So right. On and off, I do see, and I'm sure other hospitals see it as well.
Adiba, how about you? Can you weigh in on what you see at BPUM as well on this one?
Similar, exactly similar to what Yasmin's described. Yeah. We've had a few cases of reinfection rather than long COVID, but that's a separate thing again.
Okay, we're going to take some questions from our viewers on Facebook. So from Darren Lim, Darren wants to know what is the difference, differential diagnosis between post-viral fatigue syndrome and long COVID? Don't rush to answer, docs.
Well, post-viral acute syndrome is a similar. I suppose it's got overlapping entities with long COVID syndrome. It is also a multi-system involvement that could generally, it's seen a lot with other viral illnesses. I think EBV, what is that? Glandular fever sometimes causes post-viral acute syndrome. But I suppose there's some overlap of symptoms that actually can happen between the 2 entities as well.
Yeah, that's absolutely right. Yeah, that's absolutely right. And I guess the difference with chronic, with post COVID syndrome is that you actually know what the virus that's causing this, whereas often you recognize symptoms after you've diagnosed someone with COVID, whereas sometimes people, well, there's a group of patients who present with this post-viral chronic fatigue syndrome, and it's actually, we are retrospectively looking for what might have been the virus that triggered the infection. Here we have the infection, and then we watch as they unfortunately develop this long COVID, whereas in the post-viral, often they come to you with a constellation of symptoms and signs that fit with post-viral, and then we look for exactly which virus is causing it.
Take a drink, Adiba, take a drink. All right, Shireen Lim, who is watching, says she knows someone who she thinks has 25 to 30% scarring after recovering from COVID recently. I'm assuming that the scarring would be from the lungs yeah.
So that statement is overly used radiological description of COVID affecting the lungs.
Right.
So when someone says 25 to 30%, so it's a radiological description of the lungs and how it actually affects, how COVID affects the lungs. So someone less than 50% supposed to have mild, less than 75% supposed to have moderate and severe. So depending on the percentage of the lung involvement, that's what it actually means. But all this, I've seen X-ray getting completely normal during a 2-week follow-up after they get discharged, and it's more of a CT scan. It's a CT scan of the lung. It's a description of the CT scan of the lung, but it's almost reversible in most cases. But the older you are, the more effect on the, if you had any pre-existing lung condition, I suppose some of the scarrings may not be entirely reversible. That's basically what it means. It causes like a hardening of the lungs. But,
okay, thank you. Shireen Lim, I hope you had your answer to this question. All right, I think we've got other questions today. Okay, the NHS has currently predicted 10 to 20% of the UK population has long COVID. What are the prevalences in Malaysia? We sort of covered that before, Dr. Yasmin. So I'm going to say to this person, could you please check back on our Facebook feed, and you'll find the answers there. Will a diabetic person have long COVID after completion for quarantine in MIAPS? I don't know what MIAPS has to do with whether a diabetic person will have long COVID. I think it's irrespective of whether whichever institution you are quarantined at. But perhaps I can extrapolate that you're asking if a diabetic patient is more predispositioned to having long COVID. Dr. Yasmin?
We don't have that data, whether if you are premorbidly unwell with any kind of a diabetes or hypertension that predisposes you to having long COVID. But like we started off, like Prof. Adiba mentioned, it even happens in somebody who has got mild illness. And recently, if I actually have no social media account, but people who actually do say that they see a lot of even youngsters posting that they actually have symptoms of long COVID. So I don't think it's just purely diabetic and hypertensive patients developing long COVID, but I suppose because they tend to get more severe disease, they take longer to recover. So I suppose you can extrapolate it that way, unless Prof. Adiba has anything else answering.
I'm in awe that you have no social media account.
Yeah, I'm sorry. I'm actually very boring.
Don't be sorry. I think you're living your best life, Dr. Yasmin. Social media is overrated sometimes.
A fun point is Ed Sheeran doesn't even have a mobile phone.
Really?
Yeah.
Oh my gosh. Right.
I wish I can do that, but no, I can't.
Nope. You can't do that as a medical professional. Nope. So again, for the person who asked whether the vaccine reduces or cures symptoms of long COVID, Dr. Yasmin and Dr. Jamila spoke on this already earlier in our feed. The short answer is yes. There is definitely a reduction of symptoms for COVID and long COVID. Please make sure you take both of your vaccinations and adhere to your vaccination guidelines.
Actually, Karen, let me jump in there. I think the data on that is still not certain. There are reports of people who recover after vaccination if they have long COVID, but similarly, there are also reports of people who there's no impact from vaccination. So it's still not as definite as you made it sound to me. Sorry.
No, that's good. I mean, I tend to unfortunately be very black and white as an editor, but yes, I think you have every right to pull me out on that one. Thank you. So
Yeah.
listen to the professionals, guys. You know, anything that the doctors say to you probably stand more than your moderator does.
But of course, get your vaccination. Get your vaccination. Yeah.
All right. Okay, Tan Sri Dr. Jamila, we have 6,000 plus positives a day. Could you please talk a bit about vaccination for this group and how they're going to recover? Okay, Dr. Jim.
Yeah, that's an important question, because when we started with the vaccination programs, you may recall that one of the guidance was that you need to be 3 months after the infection to get your vaccination. That's been revoked now. It's been changed. As long as you are well and you have recovered from COVID and you are not on monoclonal antibody or plasma treatment, then you can have your vaccine. So say you came out of hospital, you're well, you have an appointment on your app, please go for it, as long as you've not had what I mentioned earlier and that you are feeling well. So that's the new guidance now, which means that, you know, yes, we have about 6,000 plus cases a day, and we have what, 700 over 1,000 already who have been infected, which means that a portion of them may have some form of antibodies, but we don't know how long they last, which therefore makes it imperative that people actually go and get their vaccinations done.
All right, we've got a very, very cute comment and a question from Alyssa Noraza. Are there any recommendations on how to combat long COVID at home? I recovered from COVID a month ago and I still can't smell. Due to that, I'm on cat litter duty at home. I love the fact that you're making such light of it, Alyssa, and I think that, you know, humor is a very, very big part of the healing process. But I'm going to let Dr. Yasmin take this question about how you can better recover from long COVID at home.
Right. I suppose, like I think we've made comments before. It's extremely important to adhere to a new norm of a lifestyle now. Like I said before, difficulty in smelling is a self-limiting disorder, and there are reports of the symptoms, you know, having a life of its own. So I think the cat litter duty will be over soon. But in terms of improving your general health, I think important things like that we mentioned before is having a very active lifestyle as much as you can push, not push yourself, but definitely staying in bed the whole day is not going to improve the muscle weakness that people experience, the difficulty in breathing that people experience. Actually, YouTube videos, there are many YouTube videos and some physiotherapy videos that are out there, and some links that I recently received even from the hospital that basically teaches us how to sort of breathe better and improve our lung capacity to abate some of these symptoms. Regular exercise, very mild strengthening exercise for the muscles, for those who can actually do it, are also recommended. Eating clean, staying healthy, exercising regularly, as well as getting fresh air, I suppose, is an important aspect of recovering. And of course, if you have diabetes, hypertension, and all these were previously, I've got a lot of patients who had these undiagnosed, and they come in diagnosed with diabetes and hypertension, and they came in with no medicines, and they go back with a bag full of medicines. And you know, getting all these comorbidities under control is part and parcel of recovering from COVID as well. I suppose it's not just from COVID, but it's also strengthening your immune system. So all these, it's a package. It's a package deal that we have to change our norm, I suppose. Yeah.
Yeah, absolutely. Well, we wish you a very, very successful recovery, and you know, we're just hoping that everything is going to be looking up for you soon. Okay, Prof. Adiba, would you take the other question?
Yeah, there's a question here, and it reads, asymptomatic patients with a CT value of 36 and 22. They've both recovered on the surface and have gone back to work, and are asking, should they have chest x-rays, or what should they do to make sure they're totally cured and in perfect health? Very good question, because this probably is going to be the majority of people, right, who have either asymptomatic or extremely mild symptoms. We actually don't make people have chest x-rays or CT brains or blood tests unnecessarily. We actually go by the symptoms and investigate you appropriately if you develop, whichever of the symptoms that you may have after your infection. So if you continue to be breathless and we think you need a chest x-ray, we will do that, but we will not routinely do a chest x-ray, say at 6 months post-COVID. For several reasons. One is, of course, we would be unnecessarily exposing you to x-rays. And number two, x-rays, changes on x-rays can lag behind your actual recovery. So even in those with severe disease, we may see nasty x-rays and nasty CT scans, but they're actually better. And it's not just in COVID, in medicine in general, that the findings on x-rays and CT scans can be, 1, 2, 3 weeks or more behind actual recovery. So, no, we don't do routine tests to give you a clean bill of health. That comes from taking a good history, you telling us that you feel better, you're well enough to go back to work, and that's it. We're happy for you.
Yeah, it's always the small silver linings that keep us going, Yeah, so keep on going, Malaysia. So I guess that's why medical professionals continue to stress hand washing, masking, all the things that we've been doing for a year and a half, going out when absolutely necessary, and vaccinations, of course, as a way to stay long COVID free. And speaking of vaccinations, Dr. Jim, how about an informal update? We've got 1 million new doses of Pfizer from Japan. You've ramped up vaccination rates. What else is happening?
Okay, small correction. We got 1 million AstraZeneca from Japan.
Yes.
And we got 567,000 plus AstraZeneca from Thailand from our order. We will be getting on Monday 1 million Pfizer, and then we have our regular Pfizer doses. So we're expecting 12 million this month, and it won't come all together, so it will come in stages. But this means that we just have to keep ramping up, right? The ambition is that we want to be able to vaccinate those who are eligible in Selangor and Klang Valley hopefully by Merdeka. And I specifically mentioned Selangor and Klang Valley not because other states are not important, but this really is our epicenter, right? And we need to make sure that if we don't tackle Selangor and Klang Valley, people here are so mobile, they'll start spreading it to other places.
Yeah.
So at the same time, we ramp up in other states as well. I'm really, really happy to see, and at state level, everyone's trying their best. We're seeing fantastic initiatives, not just depending on, my Sejahtera appointments, but people going out to elderly care homes, to people who are lying in bed, to the interior, opening up in places of worship, and just registering and then vaccinating. And I also acknowledge the sense of frustration from a lot of young people who may have registered very early on in February, who are saying, where's my vaccine, right? So I think that, hindsight is 2020, but in my opinion, we should have opened the registration by age, then we wouldn't get to this frustration stage. Nonetheless, all I'm saying is that July, August, we'll have a lot of vaccines coming in. So everyone just hang in there, you will get it. Now for Kuala Lumpur, 99%, I would say, of the ones over 60 are vaccinated. And for Selangor also 90% plus, which is great. So if there are suddenly people who are, you know, your family, your friends who are above 60 who have not received your vaccination, please, you know, don't make sure, number one, and I will tell you this because it happened to me. I had to uninstall and then reinstall my app, and then I saw all the different app updates among my friends, my family. So, you know, try to make sure your app is up to date, and then, you know, I hope that, you know, when we have a large amount of supplies, you know, my proposition is for every vaccine center to have a bit of a buffer so people can walk in if they're above 60 or have some serious comorbidities to actually get a vaccine. But it all depends on when the supplies arrive. Please get your vaccines. We are seeing, as you know, some variants emerging, but the good news, and again, to reiterate the point, that the vaccines will reduce your risk and our risk of getting severe disease. And this is what we want. We want to make sure that people don't go into ICU and don't get admitted to hospital. We're seeing this in the UK. We're seeing this in different parts of the world, that in the UK, for example, there are 20,000 cases a day, and they're not even flustered. They're saying that, you know, we have to let, because they're not as ill as they were in, you know, in the earlier part from last year, and so on and so forth. So vaccines do work, and we need to make sure that people take the vaccine. So the next phase, though, you know, I've said this over and over again, it's quite easy to get 50% of your target group to register. But the next 20 to 30% is the tough one, right? And Malaysians like to wait till they see people have done it. Some are very suspicious about MySejahtera and all that. So now we have to go to people and make sure that they're vaccinated.
Tan Sri, I have one question. Well, not one, but quite a few that I've gathered for you. The new update that says that people who are taking the AstraZeneca vaccine can now no longer have to wait for the 12-week that was first put in, and it's now been moved to 9. But I've also heard people say on certain sites that even before their 9 weeks is up, they've already been scheduled for their second jab. Now, is it a glitch, or is it safe, or what's happening on that front?
Okay, when we decided to do 12 weeks, it was because at the time we didn't have enough vaccines, and the UK had done this. They had their stand, which I think, you know, I must say I'm a big fan of Chris Whitty. So I think that he was brave enough to say, get one shot into everybody's arms as fast as you can. And you saw the number of cases in the UK just drop, right? And at the time, of course, they didn't have the Delta variant. So they were only dealing with the Kent, I don't know, it's called Alpha, I guess. And then, you know, they were dealing with that. So now, as a result, what happened then with the 12-week spacing was they found that the antibody response, or the immune response, was actually better at 12 weeks than at 6 weeks or 8 weeks. So there was a lot of scientific basis as well for prolonging it to the 12 weeks. So unfortunately, we're now having to deal with variants. And because of that, you know, the effectiveness of the vaccine is much better after 2 doses. So this is why even in the UK, they say let's shorten the second dose to anything between 6 to 8, 9, 10 weeks, basically less than 12. All right. So we have then, based on the calculations we have and how many doses we have available, have worked it out to be between 8 to 9 weeks. Now, if you have been given an appointment that is, say, 4, 5, 6 weeks, it's still not impossible to give it at that time. Most likely it's a system glitch, because we only recently announced that it's the 9-week gap. But say if it's 6 weeks later, it's okay. Go for the second shot.
Okay, talking about system glitches, I know this is unfair of me, Dr. Jim, but I have to play devil's advocate. So the MySejahtera app, a couple of people have said they've been waiting for their appointments, and finally they receive a notification at 10 o'clock at night about their vaccination appointment, which was 4 o'clock on the very same day, already passed. What is there something going on there, and how can these people appeal to get their vaccinations done? Because it wasn't missed by choice, it was missed by a glitch.
I can't answer you on anything, my Sujatra, because that's definitely not my department. You know how, just to share with you how the appointments are sent out, they're teed up and it's automatically sent out. So it may be system. Now for those, and I don't think there are many people like that, but for those who've had the unfortunate, experience of that, unfortunately it's EMCO, so you can't move freely about. But please do call the hotline, and there's an email and all that. It's all in your app now. In fact, in the app you can even change your appointment yourself now. Okay, but I will tell you this, as someone who sits at the vaccination center, who volunteers and all that, so many people entered their IC number wrongly. So this is why, people call and shout at us and say, I didn't get my vaccine. And then when we asked them to check their My Sujatra ID, they got their IC numbers wrong. So there's no way we can send out, or even their mobile numbers wrong. So that's why there's a problem and a delay. I'm not saying everyone, but there are, I have seen it myself. This is why I can say that it has happened, where some of my friends even call me up and scold me, right, and say they didn't get the appointment. And I said, why? And I just sort of ask people to just check, is there a problem with the thing? And then it turns out IC numbers are wrong, mobile numbers are wrong. So just double check your app and update it. And I'm not saying that's the only reason, but I can only assure you that there will be enough vaccines in July and August that you will start now getting your appointments.
Thank you so much, Dr. Jim. Always a pleasure to listen to you, and it's always heartening to hear what you have to say. One final question from Zuraina Abdul Aziz, our constant viewer, the variant Delta. Any comments about this? Zurina, we've actually done an entire episode on the Delta and the variants. It's available on our feeds. Go ahead and enjoy that episode. And with that update, we've come to the end of the session today. So thank you, Dr. Yasmin Muhammad Ghani, for being with us today on the show. Would you like to share your wrap-ups and your closing thoughts, Dr. Yasmin, please?
I know the segment's all about long COVID, but I just want to appeal from a hospital point of view. It's really not over yet. A lot, the healthcare system is sort of burdened. ICU care is overwhelmed at the moment. Sometimes it's people are even talking about getting basic necessity of care. Like we all mentioned before, it's time for the new norm. And I'm constantly worried about the movement of anti-vaccines. So I'm very glad that the session ended with vaccinations, because vaccination, and the new norm is the only way we are ever going to get back to some form of normalcy from now on. So appeal to everybody here who's watching this session to actually do their part for the country as well. And I hope you enjoyed the session. Thank you very much.
Thank you for being here for us. What you've said is something that needed to be heard by very, very many of the population. And again, on behalf of the Rakyat and the people who are trying to stay at home and trying to be good, we hear you and we are behind you.
Thank you. Thank you,
Professor Adiba.
No, I think Yasmin's put out a beautiful plea to everyone. I share her pain. I share her exhaustion, although I think hers must be about 10 times more than mine. Apart from the vaccination, be sensible, especially when we start opening up. I think, July 2021, everybody ought to know, what puts you at risk, where the risk is less, taking personal responsibility. I think Tan Sri Jim touched on taking personal responsibility in terms of good nutrition, exercise, and all that. But but being risk aware is also extremely important. Yeah.
All right, Dr. Your summation.
Yeah, first of all, Yasmin, you are one of those, together with Adiba and others, who are really, you know, the people we should all be hugely thankful for. I just want you to know that I don't think we Malaysians express enough how grateful we are to all of you, and that it is a very painful period of time where I cannot imagine the exhaustion and the mental pressure that you have all gone through. I went to Sungai Buloh on Hari Raya with stuff for all of you, and I told the director, don't disturb them. And I said, where is, Yasmin, where is Suresh? And you were all working. And I just, I don't think people understand and appreciate it enough. I think I join you in appealing to my fellow Malaysians. It's not over yet. And we can't go on living like this.
Yeah.
All right. And at some point we need to come out of this and be able to cope. But at the moment, with the number of cases we have, it's just it's ridiculous. Adiba and I have spent a good 2 hours earlier in a very, very important meeting where I think all of us just were so honest and candid and expressing that we need a different way of doing things. And I hope that, the powers that be have listened to us, Adiba, and that, we are so desperate now for change in how we manage this situation. But it begins with us. It begins with us understanding that we are capable of ending this pandemic, each of us at individual level, and until and unless we own that we are capable, we have the power within us to actually take action that will reduce our risk, then the virus, hopefully will just not be able to transmit anymore to a large group of people. And at some point, we probably have to live with the fact that there will always be some cases, just as we've lived with dengue and we've lived with, other diseases. We'll have to learn to live with COVID, which is why the normal is not going to be what we knew before. It may be that we will have to wear a mask when we're in an indoor place or a crowded place. It may be that, we have to avoid some activities, but, slowly we'll get back there. And the vaccination is one of the most important tools that we have right now, together with, and another thing about testing, right? If you are asked to test, and if you are a person under in investigation, please, I know you feel well, but don't walk around and don't go out, right? And this is why the disease transmits. Okay, be responsible, and don't be afraid to get tested, right? We've got to lose the stigmatization of, no one feels stigmatized when they get dengue, so why should you feel stigmatized if you've got COVID? It's a virus, just like any other virus that you might catch. So a big appeal from me personally, but also I think on behalf of everyone who's been working on this Sense with Science and also with the COVID management, is please, it's in us to change the course of how this goes. On a more cheerful note, Monday, will be the second round of AZ, and I will be hopefully vaccinating in World Trade Center. I volunteered to be there. I think Karen, you're going to be there.
Yes, I am.
And my Sarah and Kadi as well. And on Tuesday, I will be vaccinating people who are bedridden. So I'll be following the Malaysian Red Crescent team. So I think, we just do what we can, right? At individual level and, at organizational level. If you're an employer listening to us, please, go back to our episodes on ventilation, open your windows, make sure the airflow is good. Everything at every level, we have to take responsibility. And I do hope at some stage home testing will be available so that we will also be able to do our own home testing. Our children have to go back to school at some point. So, we've got to do all these things. So, this is yet another, heartfelt appeal to everyone who is watching, that, only if we work together will be able to get out of this. Otherwise, it's going to be extremely difficult. But Adiba and I, when we started this, I'm feeling a bit melancholic, as you can tell, because this is our 18th episode and we only committed to do 20 with our sponsor. But, we've done our best to try and bring you science in a way that is simple to understand, trying to address some of your questions and your concerns. But, we're here, right? The Sense with Science Facebook page is there. If you have questions, we'll try our best to answer you and so forth. But the power is in your hands.
I love what our viewer Daphne Sue Ayong has said on our chat. She thanks us and she says, listening to your sharings every week give me hope and new thoughts on how I should adjust myself and rethink again on how I should design my life under the new norms. And I think that is a perfect summation of what we try to do. Thank you so much, Daphne. And with that, we wrap up episode 18 of Sense with Science. I'm Karen Michaela Tan, reminding you to be the kindness you want to see in the world in the course of this week. See you all next Sunday at 4 p.m. on the show. Thank you and goodbye. Stay safe, Malaysia. Bye.
Thanks, Yasmin.
Thank you.
Bye. Thanks, Karen. Thank you.
Bye.
Bye.
Bye, Adiba. Bye, Kadi, Masara.